Greetings from real life. This is Jasmine from Real Life TV. Today is 2nd of April and we have a very special moment to raise awareness about autism. To raise this awareness session today, I would like to invite Kanishka Premadasa, a psychologist and a special needs advocate, to give you some insights and understanding about autism. So I warmly welcome you, Kanishka, to Real Life TV, and let's raise awareness and give some insights and understanding about autism to our teachers, parents, and even the young generation in this country. So it's over to you. What is autism in very simple way?
Iborn. Yes, so autism is a neurodevelopmental condition which affects how a person thinks, feels, interact with others, and experience their environment. So it begins in the early childhood and continues throughout life. And autism, it exists in a very broad spectrum, and this spectrum is so diverse that you won't find two individuals with the same course. So symptoms usually appear when a child is at least 3 years old, and there are certain cases when a child can be even diagnosed when the child has just turned one. So it actually manifests itself differently from different person to person, and irrespective of these manifestations, they usually have common difficulties in terms of social relationships, communication, and imaginative thinking. So these difficulties vary in severity and it depends on the depth of the condition. So when it comes to autism statistics in Sri Lanka, a study in 2009 found out that the prevalence of autism is 1.07%, which means 1 out of every 93 child would be autistic. And however, this study included only a small sample size and it was conducted some years ago. So at the current situation, the numbers should even be high. And when it comes to worldwide statistics, it is estimated that 1 out of every 160 child would be having autism.
Now we are aware about autism in very brief and how to identify the situations and what are the causes for autism.
Yes, so there is no single cause for autism, and latest research reveals a suspected risk pertaining to genetics and environmental factors that can cause autism. So, genetic factors include genetic mutations, inheritance, being born to old parents, and sometimes a parental exposure, the mother's exposure to certain toxins and chemicals during pregnancy also could cause autism. So, some of the early symptoms of autism include a marked delay in speech and social development, and these children often demonstrate repetitive and restricted patterns of behaviors and interests. So, issues with language and communication include speech delay. They find it difficult to share their emotions and interests, and they don't maintain back and forth communication. And when it comes to social development, they won't make eye contact and they won't respond to their name. So it will be they would prefer to stay alone by themselves. And then they have also have restricted and repetitive patterns of behavior. They prefer to do the same thing over and over again, and they get fixated to certain colors and sometimes food. So some children prefer only red color when they have toys, dresses, everything. And certain children they prefer to eat certain crispy foods and they do not like to eat other kinds of food. And another common symptom is issues with sensations. So there are certain children who have hypersensitivities and hypersensitivities. So you would have seen children, closing their eyes, closing their ears, and they do not like being touched. So these are some of the identifiable symptoms of autism. And there are also children in this broad spectrum who have Asperger's syndrome. So it is also known as higher functioning autism. So these children actually they are excellent in certain areas. For instance, they are very good at art. They could sketch maps. They would exhibit incredible knowledge in particular areas. They would have extreme general knowledge and they would be very good in academics. But still, when it comes to social interaction and stuff, they would lack in those areas.
I would like to ask you that how it is important to diagnose at very early stage.
Well, diagnosing and early intervention is very important when it comes to autism. So, early detection is the key to help a child, to live a more normal life in society. And since autism can be identified at an early age, like when a child is 2 to 3 years old, parents should always have a watch throughout their developmental stages for any warning signs of autism. So, there are certain identifiable or warning signs which indicate that the child may be autistic. For instance, if they do not make eye contact, if they do not respond to their name, if they do not engage in pretend play, if they do not prefer to stay with others, and if they have repetitive, restricted types of behavior all the time. So these are certain warning symptoms that can indicate that the child should be having autism. So it is very important to diagnose. So it also allows an intensive therapeutic effect. So interventions, if it can occur when the child is 2 to 3 years old, it's very effective because at this stage the child's brain is still forming. So it's very so it means that it's more plastic or changeable than old ages. So treatments have better chance of being effective in the long term. So early interventions not only give the child the best start possible, but it also helps the child to develop to their full potential. So with an early intervention, children with autism can make much progress. Sometimes children with mild autism, they may not even be in the spectrum when they grow older. So it's very important to diagnose and start early intervention at the right time so that teachers and parents can support them throughout. So it also benefits parental relationship. So it can be sometimes a strain to care for an autistic child, and it can be an everyday challenge. So diagnosing earlier allows parents to prepare themselves for a role effect both emotionally and mentally.
Most of the countries having their own campaigns because it's the World Awareness of Autism Day today. So how about our country and the schools, the parents? Do you think that they we have the right awareness and right directions at the moment?
Yeah, so I think actually autism awareness is growing in Sri Lanka, and speech delay is the most common reason parents bring their child to a specialist to get diagnosed. So currently in Sri Lanka, there is no population-based screening programs for autism, and it's not even a mandatory part of primary health care, which is actually sad. So numerous organizations have been working with autism, which includes autism units in hospitals, schools, and there are certain initiatives run by parents themselves. There are NGOs helping out. But still, I feel that it has to grow even further because sometimes even if a child gets autistic help for their condition, uh, there is a lack of trained specialists and lack of facilities. So in Sri Lanka, specific screening for infants and children cannot be limited to large hospitals in urban areas. So it has to be taken to villages as well, so that everybody gets aware and could get help. So there is also lack of facilities and opportunities for adults with autism. So remember, autism does not go away when you get older. So as to what I see, there is no much opportunities and facilities to accommodate them in our society.
Today is the Awareness Day for Autism. So, with your background and career as a special needs advocate and a psychologist, can you explain what are the things that we can take as adults, teachers, parents, social clubs, as a society in a whole, uh, to create a better future for children? You can share your suggestions and recommendations to make more awareness of autism and make a change for a better future in our country.
So let me start off with this. So there are many children and people affected by autism, and they need to be accepted for what and how who they are. So society as a whole, not only parents, teachers, and doctors, we all need to respect their differences, listen to their voices, understand their experiences, and create an environment where they all can thrive in. So let me say something about education. So something that I firmly believe is that children with autism too need to be incorporated. They also have the right to inclusive education. So that cannot happen just like that. So it has a process and things happen gradually. And also inclusive education is not possible for all children with autism. So it depends on the severity of the condition. And inclusive education is not practiced in all schools in Sri Lanka, but I have seen in majority of the private schools, they have started special education units and they try to promote inclusive education. So it's the responsibility of the teachers and parents to work cooperatively in this aspect so that the children can be given the best. And another concern which I have is that sometimes autism cannot be identified by just looking at a person. So if you come across a child with the symptoms that I mentioned earlier, you have to please direct them to a specialist to get diagnosed, because waiting will not help. Waiting will further worsen the condition. So taking the child to a specialist is very important, and I would recommend the child to be taken to clinical psychologist, because the clinical psychologist would diagnose and they would also guide you through as to what the child would need in the future. So a clinical psychologist would recommend therapy, the types of therapy they need, and if the psychologists think that the child would need medication, they would refer to a psychiatrist as well. So I would also like to say that autism cannot be cured with medication, and in certain situations, psychiatrists prescribe medications for autistic children, and that is for comorbid conditions that is associated with autism. For instance, sleep issues and also hyperactivity issues in children. So in these cases, children are sometimes given medication. Yes.
Since you have been working some time with special needs education, especially autism, how do you see the parents, teachers engaging with the children having autism? What should be their contribution?
Yeah, so when it comes to parents and teachers, awareness is very important. However, it is only the first step. So, parents and teachers, they have a vital role in a child's development, in any child's development for that matter. So, when it comes to an autistic child, the responsible is much greater. So, I have seen wonderful and understanding parents and teachers who have a great understanding, who have a complete understanding of their children, and also have come across certain people who are not much aware and does not know what to do and how to do certain things when it comes to children with autism. So it all comes with adequate knowledge and about the child's condition. So it's very important to understand that not all autistic children are the same. So they would have certain different preferences, different kind of support that they need, and they also have different talents and capabilities. So it's a very huge responsibility for parents and teachers to identify their child and understand the child, so that they know what works with each child individually. So not all children would respond the same way to everything. They respond differently to rewards, certain calming down strategies. Some children work only for routines, whereas others don't. So there needs to be a good understanding of the child, and it's very important to have a good mutual understanding between the teachers and the parents. So there need to be constant communication, and the parents and teachers should be on the same page when it comes to working with the child. And that way can help teachers and parents to handle children with autism well.
Even it is a very short interview, I'm really grateful and thankful to Kanishka Femadasa. She spent some time with us at Real Life TV to give you this awareness session and share some of the knowledge and insights with regard to special needs children. Thank you, Kanishka.
So my message would be, we are all different. We come in different sizes, shapes, colors, and also different brain structures and functions. So let's all embrace our differences, respect our differences, and help each other and create a world where every child and every person is loved, cared, and accepted. Thank you for inviting me.
Yes. So we will meet you again with another topic and another celebration. Until then, stay safe, stay blessed.